I am Dr. Satyaprakash, Professor and Head of the Department of Gastroenterology at the MS Ramaya Medical College and Hospital, Bangalore. Today I am going to discuss the metabolic disorders, alcohol-related diseases of the liver in the geriatric population, the pathophysiology and the diagnosis. The very old are more likely to have signs of liver disease on presentation than the young. The common presentation in the older patients are non-specific often, and they include general weakness, anorexia and abdominal pain. In those aged over 70, just giddiness may be the most common presentation. Jaundice, edema and ascites are more common in the older than in the young, suggesting a more severe stage of alcoholic liver disease if it is present at the time of presentation. NAFLD included steatosis, non-alcoholic steatohepatitis accompanied by inflammation, liver fibrosis and liver cirrhosis. All these four are present as a part of NAFLD. Insulin resistance is a major component of metabolic syndrome, which is often observed in elderly individuals. Aging accompanied by abdominal obesity and excessive visceral fat causes insulin resistance and increased secretion of pro-inflammatory cytokines and subsequently results in the metabolic syndrome and type 2 diabetes mellitus. Molecular mechanisms for the accumulation of excessive fat in the liver and damage to hepatic cells due to aging include increased reactive oxygen species, DNA damage, telomere shortening, a decreased autophagy, increased M1 macrophages, inflammatory responses, and activation of nuclear factor Kv pathways. Insulin resistance, which is known to be a primary responsible factor for NAFLD, is major component of the metabolic syndrome, which is often observed in elderly people. Aging, which is accompanied by abdominal obesity and excessive visceral fat, causes insulin resistance and increased secretion of pro-inflammatory cytokines and subsequently results in the metabolic syndrome and diabetes mellitus type 2. The prevalence of NAFLD shows the increased tendency as one gets older. The elderly people aging more than 65, the overall prevalence of NAFLD is about 35% in India. What about alcoholic liver disease? The alcohol metabolism ability of the elderly people is reduced over a period of time due to a decrease in the activation of alcohol metabolic enzymes, and the blood ethanol concentration is elevated owing to reduced distribution of volume of water. Besides, alcohol toxicity may increase due to alteration of alcohol metabolism by taking certain medications. With aging, the function of mitochondria decreases, and if it is accompanied by diabetes or metabolic syndrome, the fatty liver only will increase. As an increased generation of reactive oxygen species and a weakened oxidation defense mechanism increases the oxidative stress, and also the gut leakiness boosts the secretion of tumor necrosis factor by the Kupffer cells, which accelerate the progression from fatty liver to steatohepatitis. Such factors can accelerate the generation of liver cirrhosis by activating the transformation of hepatic stellate cells into myofibroblasts. What are the symptoms of alcoholic liver disease? The clinical symptoms of alcoholic liver disease among the elderly are more or less similar to the younger individuals, but their prevalence and complications is higher than in the other age groups. Among patients with alcoholic liver disease older than 60, about 79% suffer from complications such as liver cirrhosis. 40% of patients with alcoholic cirrhosis have alcohol hepatitis, and mortality rate of patients with alcoholic hepatitis is anywhere between 15 to 25%. What are the complications we foresee in elderly individual in these two conditions like NAFLD and alcoholic liver disease? As we say, aging is related to a bad prognosis of alcohol hepatitis. Alcohol accelerates the chronic hepatitis caused by hepatitis B or even hepatitis C and other liver diseases such as NAFLD and hemochromatosis. For those infected with hepatitis C virus and hepatitis B virus, alcohol consumption can only advance the liver cirrhosis progression and increase the hepatocellular carcinoma risk. For obese people, alcohol intake elevates excessive fat accumulation in the liver and worsens the liver damage by increased secretion of TNF-alpha and cytochrome P450-2E1. Additionally, aging increases the risk for comorbidities, especially elderly people are often under medication with other drugs. As ethanol and most medicines are metabolized by the cytochrome P450 dependent microoxygenases in the liver, elderly patients with alcoholic liver disease have higher propensity to develop hepatotoxicity because of the interaction with other drugs. The primary treatment of alcoholic liver disease is to stop drinking and provide sufficient nutrients and vitamins. Thank you very much.